question that you might ask yourself is, I have diabetes. How do I best make sure that my blood sugars are where they need to be? If you focus just on this one question, how do I take care of my blood sugars? And what do I need to do as a patient to take care of my blood sugars? Then let's start thinking how the body takes care of the blood sugars. Let's say you didn't have diabetes. When you did not have diabetes, everything that you ate, the body would sense that blood sugar rising because of the carbohydrates that you were eating. And then the body would proportionately put out an amount of insulin that would convert that sugar into energy. And when the appropriate amount of energy had been produced, the body would stop making the insulin. That's how the body functions. Now, when you have diabetes, you've got to try and do what the body would have been doing for you. Let's start with somebody who has type 1 diabetes, who is taking insulin all the time. Now, you have to take insulin, so you have to mimic, you have to copy what the body would have done. So every time you go to eat, since your body will not be able to put out an amount of insulin and you have to inject the amount of insulin that your body will need for the food that you're eating, you have to calculate the amount of carbohydrates that you're eating. So you look at your plate, and a diabetes educator can teach you carb counting. There are a lot of apps. There's apps for everything these days. There's lots of apps available that will teach you how to do carb counting. So you count the amount of carbohydrates that you're going to eat. Once you know the amount of carbohydrates that you're going to eat, you have to take an insulin that will neutralize or convert those carbohydrates into energy. So what are the two steps that are required? One is you got to count the number of carbs, and then you got to add that to the amount of insulin that you're going to require. This is called the insulin to carbohydrate ratio. Your doctor will generally help you set that ratio. 1 unit will neutralize 10 grams of carbohydrates. If you're very thin, you might need 1 unit for every 15 or even 20 grams of carbohydrates. And this might vary from meal to meal. So for that meal, you need to know the carbs, which will allow you to calculate this dose. So you take the amount of carbs, divide that by a carbohydrate ratio. Say you're going to eat 50 grams of carbs, and your ratio is 1 unit for 10 grams. You divide 50 by 10 and you get your answer, and you say, this is the amount of insulin I need for the carbohydrates. Now, your doctor has also set a blood sugar target for you, and you know that that target, in your case, needs to be, say, between 80 and 130 milligrams per deciliter before you eat. So what if you're outside of that target even before you begin to eat? You need to first bring yourself into that target, which is going to require insulin since your body's not making insulin. So you're going to have to use what's called an insulin sensitivity factor. How many units of insulin drop my blood sugar by how many points? In order to do that, you need to first check your blood sugar. So when you sit down to your meal, you got to check your blood sugar, see if you're in your target range. If you're higher than your target range, you will need to use this thing called the insulin sensitivity factor to bring your blood sugars down. Your doctor will help you set that factor, and then over time you will learn how to adjust that factor. So you take the insulin based on what the calculated dose was for your sensitivity factor. To that you add the amount of insulin that you need for the carbohydrates. That's your total dose, and you inject that insulin. So really, what you need to do when you're sitting down to eat, check your blood sugar, see if you're outside of your target range, calculate a dose for the blood sugar to be brought into the target range, add to that the amount of insulin you need for your carbohydrates, and that's going to be your dose for that particular meal. This is for patients taking insulin at meal times. Now, what about patients who are not on insulin and who are taking pills? Well, there you have to ask yourself the question every time you sit to eat. I have checked my blood sugar and it is outside the target range. If it is outside the target range, higher than the target range, then what medications you have and what you are doing on a day-to-day basis is not being effective in keeping you at the target range. Because if the medications were working and you were doing what you needed to do, then your blood sugar should be at the target range. So do you ask, have I got the right medications? Yeah, that's a possibility. You have to ask a doctor whether you have the right medications. But then you have to ask yourself the question, am I doing what I need to do? Am I exercising? Did I change my habits today? Did I eat something an hour or so before this meal and that's influencing this blood sugar? Those are the questions you have to ask. So bottom line is you really need to check your blood sugar before you eat. If you're taking insulin again, you can add up the doses of the insulin that you need. If you're not taking insulin, if you're remaining outside of your target range before you eat, you ask yourself the questions, did I eat something before this meal, or are my medications appropriate?